It was exciting for us to show today for the first time that if you screen high-risk population, meaning African Americans or people of African descent, as well as first-degree relatives of multiple myeloma, you can indeed detect a very high number of monoclonal gammopathies. And if you think about it, we know that multiple myeloma is a disease that can cause many problems. And by the time we find those patients, they're actually symptomatic. They come in because they have bone pain, fractures, and then we find the disease, and then we tell them you have myeloma. But what if we have the tools to detect it early? And I always say that cancer screening saves lives, and we do that with mammography, with cervical cancer, we know that, with colonoscopy, we know that, yet we don't have a simple blood test to screen for multiple myeloma. And it's about time, because with just a blood test, you can detect it early, and we know that if you intervene early at the smoldering myeloma setting, you can make a huge difference in survival. And I would say I would love to know if I have an early monoclonal protein. Be careful about it, watch carefully, and potentially be treated early before I have a fracture or before I have anemia. So we had a wonderful collaboration with Binding Site, and I think the amazing part that we found is when you do mass spectrometry and when you quantify the monoclonal protein at a very sensitive level, you can identify so many monoclonal proteins, and that's not surprising. We know that, of course, if you use a more sensitive test, you'll find more, but it's a question of, does it also have a survival disadvantage? Does it open us up for understanding better the biology of the disease? Can we understand better when does it happen and how does it progress to overt myeloma? And for the first time in those very high-risk people, Black Americans, people of diverse populations, people who have a first-degree family member, we found that indeed by looking at monoclonal gammopathies, we found almost 40% of the population over the age of 50 have some monoclonal protein. If you look at the numbers that are at a level where you could have potentially detected it by serum protein electrophoresis, although still mass spectrometry is more sensitive, it was about 13%. And those are numbers that are significant for our people to know that indeed if I screen for it in a high-risk population, I would detect it, and hopefully in the future I can try and understand what to do with that. So we're not saying that you have to screen everyone yet, but we're now starting to ask the questions, what does it mean to have a monoclonal protein? Does it always progress to MGUS and to myeloma? Does it always progress to other diseases, CLL, hematological malignancies? And what is the significance of all of those proteins? A lot of questions to be asked in the future, but that's the excitement about science.